Good morning. It is an honor and a privilege to be here with a bunch of data warriors. This is my favorite kind of room. To be able to step into a place where we are claiming the Indigenous value of what it means to gather our stories and the numbers and the way that our elders have always held memory and the way that they have relayed tradition and culture to us, and to say that that is the only way we will see the change in our communities, to undo the impacts of colonialism, to address the injustices that our people experience, and to always believe that we can't always just talk about how we die. We have to talk about how we live. So today I actually changed the title of my presentation. I told Rochelle earlier this morning. This is actually a title I've used a couple times, and honestly, I've failed every time I've tried to give the talk on the biology of tears. So this is going to be it. This is the time it's finally going to work. But I was really thinking about what it meant to give a presentation like this and to have the number of people online. AC told me yesterday there was approximately 500 people off and on streaming, which is incredible. When I talk about our relatives who have gone missing, who have been murdered, their families, and the fight that we have for the justice that they deserve, I thought about how do I wrap around in love and community those that aren't in this room? Because in this room, I'd like you all to think about how you're responsible to each other. I am going to be speaking about things that are really hard. For the people who pray, I ask that you do so. For those of you who practice other religious traditions, I ask that you bring that into this space, that we protect each other, and to acknowledge that there's nothing wrong with tears. So when I say the biology of tears, I don't know if you know this, but every time you cry, a tear leaks out the corner of your eye. Depending on the reason you're crying, the biology of that under a microscope, the crystals, it changes. It's different when you cry in grief. It's different when you cry in joy. And that expression of grief, that body reaction is one that the Creator has gifted to us. And sometimes we don't acknowledge as much. I have a rare honor, and that is one of my sons is here. They never come with me or travel normally. My son is here, and it made me think, he and I went to Standing Rock together. And when we came into the Pawnee camp, we got there late at night, and I could see that everybody was in the teepee that had been set up. We could see the shadows of all the people standing up. And I said, that's interesting. Something must be going on. And as soon as we got out of our car, I could hear the sound of the men singing. So we went, I opened that teepee door, we ducked in there, and we walked into a teepee where I could hear, feel, touch almost the sounds of a song that was both a traveling song and a grief song for somebody that had passed on. Standing in that circle were groups of my Pawnee relatives from the other bands that I was connected to, family members. And I saw the women with tears in their eyes. And then I saw the men, which often in the system of Western patriarchy, we talk about how men don't cry. And I remembered my father who would cry. And instead of just wiping one little finger underneath his tears, he'd do this thing that as a kid I thought was really weird. He'd take his whole arm and sweep it across his face. Not healthy in a COVID situation, but he had no shame. He had no, oh my God, I shouldn't be doing this. And in that teepee, I had brought my son into a place where the Pawnee people of all gender identities were weeping the same, and nobody was trying to hide those tears. They were wiping them with full arms, enveloped in the song that told grief, but also held healing. So as I talk to you about something that is very difficult, I want you to know I'm going to be sharing stories of rape, sexual assault, physical violence, emotional violence, spiritual violence. Again, for the people that pray, I ask you to do so. If you experience any kind of distress, I want you to walk out. I want you to turn off the computer. It's okay. Doesn't hurt my feelings at all. Protect your hearts. It's just as important for us to be well and whole. And I want you to have and be able to have that place of peace. This is a picture of Mentasta Lake. My name is Abigail Echo Hawk. I'm a citizen of the Pawnee Nation of Oklahoma on my father's side. I was born and raised in the heart of Alaska amongst the Upper Athabascan people of Mentasta Lake, Alaska, where my mother is one of the adopted children of Katie John. And this is a picture of our Mentasta Lake, of our Fish Creek. These are our mountains. I remember as a child, I would walk into a creek that was so cold, my feet instantly turned pink, coming straight out of a glacier, that water. But at certain times of the year, it would be so thick with the salmon that fed us mentally, spiritually, emotionally, that my dad could lift one up with his hands. It was like a big joke. But it healed us. So as I talk about this crisis of missing and murdered Indigenous people across this United States, make sure you know where your place of peace is. And when I come to Mentasta, when I step off the plane in Alaska, when I talk to people like Miss Sylvester over there, I know I'm home and I know where I belong. And that in itself is the kind of cultural Indigenous data that will never leave me, that will never leave my son, that will never leave my sister, that will never leave all of you in your tribes and your communities. And when we can center ourselves in that, there is nothing we can't overcome. But we have to recognize that we are living in a crisis of missing and murdered Indigenous peoples. And I'm going to interswitch with missing and murdered Indigenous peoples, which encompass is all. And I'm also going to talk about missing and murdered Indigenous women and girls, because we have to acknowledge that there is a crisis of violence, physical violence, sexual violence, domestic violence, specifically against our women and girls. That doesn't mean that it doesn't happen to our men, and it is absolutely happening at even higher rates to our LGBTQ plus two-spirit community. But when I talk about the women and girls, and this is something that I've had great conversations with Lucy Simpson from the National Indigenous Women's Research Center, is that from our cultural beliefs and the ones that I was raised in, that when our people who give birth, when our women, those who carry the next generations and carry the culture, that they, when they are whole, it reverberates out. I see my friend Dr. Don Warren here, and it reminds me of something that his mother told me. I didn't have a lot of time to interact with her, and the very few times I got to spend with Beverly Warren, she said some of the most impactful things I've ever heard. One of the things she told me as I was doing some work with her and as an elders panel in Shakopee, and she's like, Abigail, sometimes some people might not believe that what you feel or how you're saying it, that she's like, they might think you're like fake. She said, I know you're not. And she said, I also know that when we are in our culture and tradition, that's where we need to be. And those words ring in my head. And I want to thank you, Dawn, for the gift that your mother was to all of us. That when we come in this way and we talk about this subject, and when we ground the way that we do the intervention, prevention, and the gathering of the stories, when we come in that way, that is the only time we're going to see things change. And I want to set a common understanding of what the crisis of missing and murdered Indigenous women and girls is. I get a lot of calls. A couple of months ago, I got a call from an uncle who was weeping on the phone, a former law enforcement officer who told me the story of his niece who had been found. She had been found hung in a bathroom. He told me the story of how the law enforcement didn't even bother to take pictures, didn't do anything, didn't investigate the potential perpetrator who had previous convictions of domestic violence, didn't take pictures of a man who walked with blood smeared across his naked chest out the door, and instead told them, oh, this is obviously a suicide. And I told him, I wish this was the first time that I've heard that story. But it's not. We see some of the data that we have created that is important, like was just talked about by NIHB, where it's used by law enforcement as an excuse to not investigate. And that data is used by perpetrators to stage murders because they know the prejudice and stereotypes and implicit bias in law enforcement will say, this young woman hung herself. We don't need to investigate anything else. I get a lot of messages, text messages, DMs, random Twitter messages. The last 2 days, I've been working with a family of a young person who was murdered, and all they needed was a lawyer. They couldn't find anybody to help them. They found me online. No resources in their state. Very lucky last night at 11:30 p.m. Eastern Standard Time, I had an attorney who said, I'll do it. And if I can't help them, I'll find another attorney who will. I listened to a lot of stories. I had been invited by USET to come and to present the work that we do at the Urban Indian Health Institute to tribal leaders, the USET tribal leaders. And so I went over some of the work that we've done, including an incredible study, the very first of its kind, on violence against urban Indian women that was done along with Colin Gerber over there with CSTE now, one of my former staff and beloved family and friends in this work on data. I tell the story of that research and I step off the stage, and out of nowhere, I'm like, I don't know where these big giant tribal leaders came on. They're all the size of Don Warren. And out of nowhere, this little tiny beautiful elder comes running through. She's got hair almost down to her knees, and she grabs me by my hand, and then she pulled me to her by my face. And it was almost like our hair fell together, creating this little room. And she said, Abigail, I buried every single one of my sisters with bruises. All 4. And as we dressed them to spend those last moments with them, not a single one of them ever saw any kind of justice. She said, Abigail, this just isn't my story. This is the story of my tribe. This is the story of your tribe. This is the story of your urban Indian community. This is the story of your state. This is our story. And as she held me there and I could see the tears creasing down her beautiful face, I'll never forget what she looked like. She said, we have to keep fighting. She walked out of those big, tall tribal leaders that came out of nowhere, and I never saw her again. But I always feel her with me. This crisis didn't begin 10 years ago, 20 years ago, it became 500 years ago, where there's now a Disney movie that talks about Pocahontas, a Pamunkey tribal member who was kidnapped, sexually assaulted, trafficked, and died away from her family and tribe in Europe. But Disney wants us to believe that she runs around with one strap hanging down in a mini skirt, singing songs through the forest, waiting to find that colonial, extractive, destructive, genocidal love. So we are dealing with deeply embedded, deeply situated implicit bias that exists not only in the narrative of the over-sexualization of Native women, in the justification of the murder of our men. It is perpetuated by Hollywood. It's perpetuated by people who don't get access to resources and trainings. It's perpetuated by systems like the Department of Justice, who have yet to fully comply with the trainings that were detailed within Savannah's Act and the Not Invisible Act. And I want to acknowledge that there are so many people that I live in relationship with, that people I don't know, but I admire from afar, from individuals who have fought for the safety of our people for decades, for centuries. As a result of the work that I was blessed to be an incredible part of, I've sat with tribal leaders and I've heard them tell the federal government, we have this crisis, our people are missing, our women are being murdered, serial killers are targeting our reservations, homeless Native women are disappearing off the streets of Seattle. And nothing. They would say, you have these stories, but where's the data? The CDC data doesn't show us. That doesn't exist in the National Violent Death Reporting System. And so I reached out to an incredible, brilliant young person, Anita Lucchese, in 2017. And we started and then published in 2018 the very first study on missing and murdered Indigenous women and girls. And I want to say something very clearly. This was done specifically on urban Indian communities, 71 cities across the United States. And I did that purposefully. It was with the intention of showing that this crisis not only existed in the reservations and villages, but we were in a time at the federal government level where there were opportunities in Congress to shift policy as a direct result of having the data that we needed. And I also knew that I am a tribal person living in Seattle. I am a Pawnee tribal member, and my feet are rooted in the soil of Mentasta Lake. I am tribal regardless of where I live. And this study had the ability to impact not just urban Indian communities, but all. And we saw it happen. This data is outdated. This study was in 2018. I just saw this information used recently, and I think it's very important for us when we talk about data, what is the lifespan of it? This was the very first data that was ever done, and we need to talk about it as such. Is the data that was found in 2018 always going to be relevant? It might be in New Mexico in this particular community, but it can't, we can't always just say, well, because this happened, this counts for everything. The other purpose of this data is the whole point of our report is that this data, while devastating, the youngest person in this data set was 8 months old. The oldest person was 81. The most important part of this data set was it's absolutely incorrect. Because what we found was that law enforcement agencies across the nation, didn't matter if you were in Seattle, Washington, New York City, Rapid City, South Dakota, the Bay Area of California, nobody was gathering data correctly for American Indians and Alaska Natives. For example, Santa Fe, New Mexico, highest minority populations are Hispanic Latino people, American Indians, Alaska Natives. At the time in 2017, 2018, we're only gathering law enforcement data if you were white or black, which allowed for the deaths of our community to go hidden. And then we found law enforcement databases that if you didn't collect race or ethnicity, they defaulted the victim to white. Race is not a default. Responsibility to a political class of individuals like American Indians and Alaska Natives is not a default. And yet, these law enforcement databases that agencies across the nation were just, buying off the shelf would just automatically default to white. And then I heard from law enforcement who said, nobody ever said we needed to do this, nor did they ever say how to do it. So that was the work that we then embarked on with this information. And the biggest barriers that we found was the system itself. In 2019, after that report came out, the very first state in the nation went out, worked with tribes, gathered qualitative and quantitative data, and created a report, 2019, the very first one in the nation, on the impact on missing and murdered Indigenous people in their state. It just happens to be the state that I live in, Washington. And I was watching them do it. It was a result of the work that we've been pushing forward, except for when the state legislature passed it, they handed it to the Washington State Patrol, and there was no there was no consultation on the methodologies that would be used, the protection of the information that would be used, the analysis, nor the dissemination. And what we saw when that report came out was devastating to me. And in fact, I cried. What we saw is the Washington State Patrol actually handed the data to a woman who had never done data before, who had no idea what she was doing, not her fault, a Black woman. They handed it to somebody that they thought would be politically acceptable. And she did her best. But here we have somebody who's never dealt with qualitative data, quantitative data, has no knowledge of working in American Indian, Alaska Native communities. And what we saw instead was a tokenizing report that did not create any new information, that did not give us the, I sat there and listened to tribal leaders and family members lay their hearts and their stories on the ground. And instead I saw the state of Washington stomp on it like it meant nothing. My team created this graphic for me because I was in this time of rage. And I'll tell you what, red rage is a real thing. Talk to Faith Spotted Eagle. And it can be used in some good ways. We can't let the anger make us bitter, but we can let it drive us towards justice. And that's what my team in creating this helped me do. And I had no money for this, had no money for the first report. We do what the creator has directed us to do. And you ask people for help. One of them is sitting in the back room, my sister Lael Echohawk, who brought in the legal expertise and did that with no money. The answers to our community's problems are that we experience as a result of ongoing colonialism is within our communities, is within asking each other for help and answering the call, answering the text, answering what the Creator is directing us to do. We released a report, a counter narrative report, that took the data they had released, because they also did something that was improper. They released all of the transcripts and notes from all of the 10 tribal gatherings publicly. That is not Indigenous data sovereignty. That is not protecting families and communities. And that is not respecting the tribes in which they were interacting with. But here I had it. And so in consultation with the tribal leaders, my team and I analyzed that data and put forward a report that countered the narrative of what the state of Washington did. And I did this for a couple of reasons. One, that data deserved to be held with care. To recognize every story is a relative. To pray over a data set of our murdered people because they are our ancestors. To recognize my responsibility and my team's responsibility to them. And Colin will tell you, I hold that very strongly. Regardless of the race or ethnicity of my team, we can root the way we do our work and the way your tribe and community do your work in your cultures, your community, and your tradition, and hold that. We can do it. The other reason I published this is I knew as a result of the 2018 report, we were seeing potential legislation. I saw incredible grassroots leaders with this report in their hand, like the arrow in their fist, demanding change at their state level. And I wanted to show every single state in the nation, if you mess it up, we're coming for you. That's okay for us to do too. Our ancestors were fierce warriors for their people. They were fierce. And they did it for one reason only, which is also different about the way that Indigenous people hold data. It's not because I care about publishing a paper. It's not because Don cares at all about what his position is at a university. If you know him, you all know he'll leave the university to go to the right place to do the right thing. We do it for the love of Native people. We do it for the love of the land. We do it because our ancestors did it before us, and our ancestors will do it after us. That is the direction we have to go. The front of the Washington State Report had this picture. It's interesting because this is a photo from an incredible artist out of Canada, and these are pictures in this woman's blanket of women who are murdered in Canada. I was like, what is this doing on the front of a Washington State Report? Yesterday, my incredible colleague and team member, Lenice Baker, talked about the importance of art. This is the data. This is somebody's mother. So I reached out to that artist and I asked him, I said, did the state of Washington get your permission to use this? His answer was no. It had no context to the community. It was harmful. From my cultural beliefs, harmed these families. So the Urban Indian Health Institute paid this artist out of respect for his work. Because that's our responsibility. If the state won't heal, we will. And it doesn't mean that we won't push them to do what is right. As a result of that report and the advocacy that had been going on around missing and murdered Indigenous women and girls, we saw the passing of Savannah's Act and the Not Invisible Act with strong bipartisan support. I wish Senator Murkowski was here. She's an incredible woman. She has been such a strong supporter of this. She has fought for the lives of our Alaska Native women. She has fought for the lives of all Native women. And in fact, when we released our 2018 report, she sponsored its release and we released it at the Capitol, just some blocks from here, with Senator Murkowski. Senator Murkowski, during the Biden administration, only voted for the individual who was the secretary over the Department of Defense because that individual said that she would fight to bring about the change and implement Savannah's Act and the Not Invisible Act. President Trump signed into law alongside tribal leaders, Savannah's Act and Not Invisible Act. And in fact, President Trump is the very first president to implement the Remembrance Day of May 5th. We too often forget that this is not a partisan issue. This is an issue of safety. This is an issue of upholding tribal sovereignty and treaty and trust responsibility of public safety. And Savannah, in our 2018 report, we highlighted that Savannah's Act was named after Savannah Greywind, who was brutally murdered. However, Savannah's Act and the original writing of it would not have helped Savannah nor her family because she was killed off reservation. I work with friends, and right now there's a case in Montana where the perpetrator is laying Native women 800 to 1,000 feet off the reservation line because they know that it messes up the jurisdiction. They also know that these particular counties are less likely to investigate a Native person's death. And they are using the maze of jurisdiction to allow for both serial killers and other folks who murder our people to operate. As a direct result of my team's work then and then moving forward, and one of my former staff, Christina Diego's in the room, who is directly part of us ensuring that urban Indian women, urban Indian people were included, and we included in Savannah's Act provisions that said public safety and particularly data and training for law enforcement, regardless of whether they're tribal or if they're in urban communities, is embedded in Savannah's Act and is embedded in the Not Invisible Act. This legislation passes 2020. What happened? Anybody else remember what happened in 2020? COVID happened. During COVID, I got more of those calls, texts, emails than I do right now. And right now, sometimes I don't want to open up my email. During COVID-19, we saw an increase of missing people, murdered people, sexual violence, domestic violence, because many people were now quarantined with the person that they could normally escape to go to school or to go to work. We saw brutal murders that didn't get investigated, women set on fire in fields. Department of Justice said, COVID, we didn't have time. And in fact, a 2022 Government Office of Accountability report came out in regards to this and found that the Department of Justice had not fulfilled the mandates of Savannah's Act nor the Not Invisible Act, including doing the simplest thing, which was appoint commissioners to the Not Invisible Act Commission, which was to go out, be appointed from the communities. We actually worked and navigated who was going to be in those in that group. Also ensuring there was representatives of urban Indian communities. We had one, Sonia Tetanowski. It took them almost 2 years to simply put a group together. So do you think they were doing the trainings? They weren't. And our urban law enforcement, we know through the best census data that we have, about 76% of American Indians, Alaska Natives live off reservation. We know that there are perpetrators, like I just said, placing bodies, trafficking people off of tribal lands in order to avoid federal investigations. We have law enforcement who have no idea except for the embedded stereotypes and prejudice against Native people, which always starts when a young person goes missing. Always. I have never worked on a case where this hasn't happened. Has she run away before? Does he have a drug problem? Has he been fighting in school? Today, I grieve with the family of Emily Pike, the 14-year-old who was recently found dismembered after missing. Her killer currently free. These are the young people that they judge, acting like their bodies are maybe just like Legos that will never snap back together again. They weren't fulfilling Savannah's Act and Not Invisible Act, which specifically had the mandate to change databases, to train law enforcement on how to ask for race and ethnicity, and to look at the pathways in which data should be shared with their tribal communities in regard to their tribal members who are missing. This picture is actually of a ribbon dress I made out of body bags. My organization, Seattle Indian Health Board, was sent instead of PPE. That's a whole nother story. During COVID-19, but I made this dress because I refuse to accept death for our people. I'm not going to let them give us body bags. We will only have life. And I think about this because my son is sitting back there. I had this laying on the floor of my kitchen and I had my youngest son with me, and I had my hand in a paper plate full of red paint. And I was marking this and he was helping me pull it off, and the two of them was there. This son was actually sitting in the living room, and I told them, I said, sons, I would never leave you. If I ever go missing, it's not because I chose to. And if you ever need my fingerprints, they're on this dress. Native women, I have yet to meet one of us that hasn't said something similar to a partner, to a family, to a friend. And in fact, May 5th is one of the hardest days for me. And I only work with Native young people, Native women, almost all of them who do their projects in high school, and almost all of them are doing MMIW. So we have young people who are advocating against their own murder. And we look at the lack of investment of behavioral health, dollars, lack of investment in law enforcement, lack of investment in chronic disease prevention, who people experiencing anxiety, or for example, they may not go out and walk in their neighborhoods because their mothers won't let them because they're afraid they may be kidnapped. I got a message last night. I checked it at 1:30. It was 1:30 a.m. It was from a friend of mine in Alaska. And she said, Abigail, I need to put together a plan for a gathering we have. It's a big gathering and I need safety plans for the women. She's like, do you have one specifically that we can work from Alaska, for Alaska Native women? And the worst part about that call is I do. So we plan for how to protect ourselves. And we tell our sons, this is where my fingerprints are. The why and how on MMIP data should be being done by the Department of Justice. And I will say there is incredible tribal folks who are working on this in their tribal communities. Do you know who's the best at gathering race and ethnicity on Native people? Tribal law enforcement. They already know how. Most of them are related to us. They know how. They don't have access to the systems to share that appropriately through, for example, NCIC, which is a FBI database. It's a database that we can work with. And there's difficulties and lack of resources and funding with tribal law enforcement sharing that data. So we have perpetrators who do what we call res hopping. And I worked in one community where this individual res hopped across 4 reservations where he was a violent perpetrator of domestic violence. And on the 5th one, he killed her. But because they couldn't share information, it wasn't known by that county and it wasn't known by the law enforcement, the tribal law enforcement, because there was no way to share that data. So there is actively people working on this right now. There is dollars set aside in the Violence Against Women Act. The fierce warriors of the Violence Against Women Act, Lucy Simpson and her team, the regional coalitions across the nation. I just sat in a room with them at the National Congress of American Indians. It's my favorite room to go in. It's like you walk in and the fierceness of Native people hits you like a wave at the door. And it is both the tears that we cry and the grief of the stories we share with each other, and also in the fierceness of the tears that intermixes the biology of those two intertwined together, saying, not another one. Not another one. We won't let it happen in silence. MMIP data, the why and the how. The why right now is the Department of Justice has never fulfilled the training requirements on building out these data systems. The why is they did bring together the Not Invisible Act Commission. They did it too fast. The commissioners, I raise my hands in gratitude to them for the work that they did in such a short amount of time. And I remember my friend in South Dakota who runs the coalition there, and they're like, we didn't even know they were coming. We had families who wanted to come and share stories, but there was no transportation dollars for them. They did it so quickly because they were under a federal mandate, and they had waited 2 years before moving forward, that the work of the Not Invisible Act Commission was incredible. And they did the best with what they had. That report has now been removed from the Department of Justice website. And we need tribal leaders to stand with us and say that is our data, that is our people, and we have a right under Indigenous data sovereignty, which is under the shield of tribal sovereignty. That data is ours. Put that report back, or if nothing else, I'll host it. I'm looking at a bunch of warriors in here. You'll host it. Who would host it with me? Hell yeah, we'd host it. That's our data. That's our stories. And we need to hold this administration and every administration. We need to hold them responsible for upholding treaty and trust responsibility. And our data is our people, is our ancestors, past, current, and future. That's an opportunity for advocacy. The data that is held within that belongs to us. My organization, instead of waiting, we decided we're not waiting, we're going to keep doing it. So we have put together a training specifically for law enforcement. We've trained the 13th largest county in the nation that has a strong urban Indian community along with 2 federally recognized tribes. I have trained other law enforcement agencies where I sit with them and go through, and I'll show you some of the data pieces related to this. We have an in-depth training that goes over everything that includes what data should be gathered. The biggest issue we run into is they're just not collecting American Indian Alaska Native. If we can get them to that. The first agency I worked with, it cost them $50,000 to change their database because they did not have that. But once they worked with their vendor figured out that they could make more money now that they had added this. And they're actually using our work as part of the training and part of their push to get other law enforcement agencies to buy their product. We're also missing out on the economic development component. Right now, I'm okay with them doing that because how else are we going to get law enforcement to just gather that one basic thing? It's worth it. But I also think our people should be the ones who benefit, because nobody should be benefiting off of the bodies of our people. Nobody should be benefiting off of our trauma. And we need to have solutions shaped by us and for us. And quit trying to solve us like we're a problem. Native people are not a problem to solve. And this is one of the biggest problems with Western public health. Let's identify a problem. Let's use epidemiology to say this. Let's look at the course of disease over time. That's the definition of epidemiology. Course of disease over time. What if we looked at the course of healing over time? What if we looked at the course of intergenerational strength over time? What if we looked at the advocates that in just the last 5 days I've been in relationship with, Mary Catherine Nagel, Charlene Opick, others? What if we looked at the strengths of our people over time? We are not a problem to solve. We are every single one of the answers. And I want to share with you an experience I had with Sonia Tetanowski, who runs the Urban Indian Health Program in Santa Fe, California. They had and have one of the largest population of urban Indians. 1 out of every 7 urban Indians live in California. And they have a huge issue with MMIP in San Jose. They were not getting, and nor was law enforcement being able to access any trainings from the Department of Justice, from the FBI. This law enforcement agency got Sonia pounding at their doors. That woman is fierce. She's pounding at their doors saying, you're releasing information, you're not serving our communities, and our people are dying. but because we're the answers. And Sonia is fierce, and so is her team. She forged a relationship with the chief of police in San Jose, California. She worked alongside others to pass and this is specific to data, but I want to share one of the things that Sonia passed, and that was the feather alert in California, which was also based off of work that we did in Washington. That is a missing persons alert. In Washington state, we have found relatives as a result of using this. We have other states with legislation to improve MMIP data specifically, because the people who are pushing are the Sonia Tetanowskis, is my friend Monica in Colorado, is Nikki Cristobal in Hawaii, where we know our Indigenous Hawaiian brothers and sisters, Mahu, suffer the same fates. And in fact, in Hawaii, unfortunately, with a lot of this legislation, they don't give money, because that's the best way to tokenize something, is to say, okay, we did it. The Indians didn't help us out. Oh, there wasn't enough resources. So legislation that passed without a fiscal note to change data just isn't going to work. Well, it was passed in Hawaii, and it was handed to the Native Hawaiian women. They didn't give them any money. The Urban Indian Health Institute is now the largest funder of the MMIP data work in Hawaii. And it's not a lot of money. It's $175,000. But why is a small nonprofit in Seattle the one funding the work to end a crisis of violence that has been created by the United States government? But I know our dedication to sharing with our relatives and supporting each other. Representation matters. And when we talk about get out the Native vote, you can look at these states and you know who's sitting in their state legislatures. You know what you fought for, but how do you ensure that they're accountable? This is a slide I used in San Jose, California, where we pulled census data, talked about the underreporting of that. But this is one of the things I shared in many of the 42 detectives in the room who investigated murders, who investigated homicide, trafficking, missing persons, had never heard this information before. This information is key in the education of individuals. They had no idea, and I told them this is a gross undercount, but there was 18,000 Native people living in San Jose, California. I guided them through how to talk about race and ethnicity. We have this guide specifically for law enforcement on our website, UIHI.org. It details how to gather race and ethnicity. We do trainings related how to do this with law enforcement. People are very uncomfortable with doing this. People who do not identify as a person of color struggle with asking what somebody's race or ethnicity is, and they will often visually decide. And most of the time, it's just easier to say white. We train them on asking about race and ethnicity. And we go over what a data response to missing and murdered Indigenous peoples are and talk about the data categories. We give them suggestions related to race and ethnicity, walk through when they'll give us the opportunity, doesn't always happen, but we have walked through with their data folks every single data field within their databases, giving them specific examples of how to enter race and ethnicity and also tribal affiliation, not tribal enrollment. Some of them are like, oh yeah, who's enrolled? None of your business. The only person who decides who is a member of a tribal nation is a tribe. Nobody else, none of your business. And we educate them on why that is. We provide them in-depth education on how to do this and to adjust their database systems to appropriately collect. And then because I'm super nerdy and love this stuff, and also because we are the answers within our communities, we tell them how to do the analysis. So the booklet that we have details basic analysis, everything from suppression of data to how to build data sharing agreements with their local law enforcement. I also worked with one community where I guided them through what a tribal consultation was. And I did it with them and the tribe. As a direct result of that tribal consultation, this law enforcement agency is not only co-training prosecutors, they have an internship program that they're working together on, and their sexual violence, domestic violence, and victim support services are, for the very first time that we know about, working together to bridge the underfunding of victim services, to use what the tribe has and to use what the county and the cities have. The opportunity is there, and there are many law enforcement who are they don't know what to do. That's the most common thing. They come and tell me, is like, we understand this is a problem. We don't know what to do about it. I said, that's okay. We know how. Your tribes know how. Your urban Indian communities know how. And there are data experts, data warriors, data defenders in this room and online who know how. And we need to come together to make it happen. I also work with them now. This is something new that we started doing because we were having so many issues with the way that they interacted with the families in terms of cultural missteps. And this is some of the training that I do with them, and we walk through each of these and I give them specific examples of where mistakes happened in cases and where things went right. And I think about a person that I work very closely with, somebody I deeply, deeply respect, a Native woman working in a law enforcement agency. And we had a woman who she had been murdered, her body held in a closet for weeks, being sexually assaulted. Horrific. One of the worst cases I think I've ever seen. And because of the type of forensics and things that needed to be done with her body, you know, many of us have ways that we bury our people. As a Pawnee person, we bury people in 3 days, same as our Athabascan cultures and communities. And that wasn't able to happen because they needed to do this investigation. And the family suffers. The families suffer. When things happen, like in some tribes, you may not say an individual's name who's passed away for a year. But here you are in a court case, and all they do is say that name over and over and over again. Pop up pictures you're not supposed to look at. Those cultural considerations. So this woman, this Native woman in a law enforcement agency who fights so hard with a body that this family just wanted to be with. She went into that room, she told me, she said, I just sang for her. She sang the prayer songs that her family could not sing next to her. She prayed the prayers in that room with that body, with that woman, with that spirit, with that loved one, with that new ancestor that the family couldn't be there for. We need our people in law enforcement, and we need to build up the law enforcement folks working in databases that don't allow for a default to white. We need to work to have law enforcement like this individual who train all of those around her, because then some weeks later, I was watching her boss, also a friend of mine now, in it was a individual who had lit a woman on fire and then killed her. And he was trying to get a pardon. And I listened to a white man give one of the fiercest arguments I've ever heard about how that would be wrong, about how that does not respect her tribe, her family community, and how it does not take into consideration the impact of ongoing trauma of MMIP. He stood with us. Those people are there. When we train them, when we work in relationship with them, when we build bridges that they walk across, because they got to walk across and you got to hold them accountable to it. This can happen. And when I think about those people who are walking across those bridges, ensuring things like tribal consultations happen in states, because right now, working with your states is essential. Do not depend on the federal government to make sure that the data happens for your people, by your people. Work with your states. We also need to ensure urban confers happen so the urban Indian communities are consulted, like happened in San Jose, California, so that we know what is happening with our relatives and we can also get them the resources and services that they need. We need to fight for these ones. These are my nieces. We need to uphold tribal sovereignty And this is the why. The data can't be looked at as a data set held in the CDC and the National Violent Death Reporting System. It can't be looked at as the responsibility of only one law enforcement officer. It can't be looked at as only the one pet topic of that certain tribal council member. And it can't be looked at as not having relevance to public health. I got called upstairs to where my, I work in below our clinic. I'm 500 feet away from our elders and right below from where our relatives receive culturally specific care. And I got a call from my team and they said, there's a woman here and she says her sister is missing. I said, I'll be right there. We go up, incredible Native woman, survivor of the boarding schools, been living on the streets for most of her life with her sister. She said, my sister hasn't contacted me in 48 hours, and we have an agreement that if we don't hear from each other because of the violence they experience on the streets, something's happened. So we worked with her. We were, working, calling the police. We're sitting there with her. She's telling us all these she's laughing at the same time she's crying. And we're chatting, and law enforcement, in the time that she's there with us, about 4.5 hours, we had enough ideas where her sister might be, is her sister was found in that amount of time. And so she's hugging me, and she hugs me, and she smelled like wood smoke. It's a very particular kind of memory for me. I walk into my grandma Katie's house in Matassa Lake. It smelled like moosehead soup and wood smoke from the big stove. And she hugs me, and I know she smells like wood smoke because she lives on the streets, and she doesn't just survive. Here she was in her thriving in the protection of her sister. And then because of how she protects her sister and how all of you use your public health data to advocate for treaty and trust responsibility. So members of Congress that I want to talk about, and I moved it specifically to this slide, who are standing with us as fiercely as my relatives are dancing here. This is a picture of my grandma Katie's potlatch when she walked to that next place, and we danced in eagle feathers and Jordans and in Levi's and in vests and in dresses and in leather. So we have people who are standing with us. Senator Murkowski, the recent hearing that I was a part of in November held by Representative Simpson in the House, a Republican from Idaho. We've got an incredible advocate in Congressman Elsley, a Republican from Texas. We have Senator Patty Murray from Washington State, a Democrat. We have Representative Ruiz out of California. They held that hearing, and I just was at congressional testimony last week. And when I walked up, they said, "Oh, Abigail, it's good to see you." And one of the staffers said, "We know you're going to bring the data." And that's what the staffers in the community were working for. Our accomplices and allies, they dance just as hard with us and don't disregard them. But we need to be the ones shaping the data, the story, the relatives who deserve safety and justice. So that woman who reported her sister, she gives me a big giant hug. She smells like wood smoke. She reminds me of my grandma. And then in walks the incredible team of the Seattle Indian Health Board, like many of your tribal teams, like many of your victim services. They had a tent for her because she said she didn't have a tent anymore. They had a warm blanket. They had socks. They had gloves. And I walked her out that door, and I saw her put those things on her back as she walked back out to the streets that were trying to kill her. And she also walked back into the streets as a strong, fierce Native woman who would do whatever it took to protect her sister. That is the strength of the community we live in. That is the data that we hold. And it is my prayer that all of us become the data defenders, the data warriors that we all need. And you'll see that on the front of the t-shirts that my team is wearing right now. And I purposely had it done in graffiti because the beginnings of graffiti were all about political resistance. And it's fierce. And it's led by that woman, again, for that cultural purpose of when our people who give life are healthy, well, and whole, it reverberates across our community. And we're just not going to talk about how we die. And in fact, OPIC, my dear friend from Alaska, they have a whole project that is about how they lived, how they were loved, how I love them so deeply right now that the tears that flow out of my eyes at a phone call that says, how do I keep our women safe at a gathering in Anchorage, Alaska, is out of the gratitude that somebody calls me. And I cannot wait until there's thousands of people to call. I cannot wait until tribal leaders stand with us, not in a side room of NCAI down in the basement, but on the center stage. If you hear me, Larry, let's get our VAWA group on the stage at NCAI this year. We need to do more than post a remembrance. We need action. And the data. And in fact, this last congressional hearing was one of the most impactful to me because I walked on, they said, we know you're going to bring the data. The data is essential to the way that their resources are allocated, but it is also essential to the reclamation of who we are. When I stop and pray over a computer that holds a database, that is my ancestors flowing through me. That is the smiles of our elders like Bev Warren, Faye Spotted Eagle, Cecilia Fire Thunder, and my friend Patsy Whitefoot, who fought for the return of her sister's body for more than 30 years when they finally find her. And that woman fights fiercer than anybody I've ever met. And I know that for my son, he's not going to be marking red handprints on body bags so his children can find him if he is gone. We are the opportunity for change, and data is part of who we have to be. The biology of all of our tears is that they intermesh with every tribal person. And that when we say all my relations, we mean it. So to all of my relations, I'm excited to be in relationship with you. Data warriors, stand up. Thank you.
Thank you, Abigail. We have about 10 minutes for a few questions. If anyone wants to ask a question, Abigail has graciously agreed to respond.
I do want to make one comment. I didn't go into it as much. For all of the data nerds, in our UIHI.org, our law enforcement booklet has advanced statistical analysis that talks about the ways to protect the data when you're working with MMIP. So for those of you who are epidemiologists or working for states, we have the basics, and we also have some of that more advanced statistical analysis. And I want to just acknowledge my dear friend who many of you knew, Adrian Dominguez. He and I wrote that together. He's passed on, but that work lives on with him.
Thank you. Can you use the mic, please? Sorry, so everybody online can hear. You press once and it'll be green. There you go.
Now, okay. Earlier when you said if the states aren't going to heal, then UIHI will. So I don't know if you meant heal like is a heal in a wound or heal as in obey. But for me, we are at that point because there used to be a point where there was no data collected for natives. Now there's ample data collected, but you can't get it back. So it's a game of data chess now. It's like we have the data, we're not giving it back to you. This is a problem we have in the Great Plains right now for public health, the syphilis, COVID, all that kind of stuff. So the states won't give it back unless, as you said, the tribes give over their enrollment data. And the tribes are, like you said, not their business. So now we're playing this data chess, and you have to make sure and stand or stick with your guns and say, we call the shots, not you. Because with RWJF doing this thing, I was also part of a MacArthur thing. All of these philanthropists are taking over the role of the government, and they shouldn't have to. That extra money that they give should be for extra things, not things that the government is failing to do. And, oops, am I still here? And the other problem with that is we, Native Bio, were trying to work with RWJF, and they were dictating terms on data sharing. It's like, no, you don't dictate terms on data sharing. The reason why these are problems and why we're playing data chess at the moment is because the funder always dictates data sharing. Whatever the policy is, whatever the use is, whatever the interpretation is, or as we heard yesterday, the evaluation, how it's evaluated, whether or not it's doing the work that it's supposed to be doing. So that I want to call to people's attention is you have to bring funders, states, and federal to heel. They listen to you, not the other way around.
Absolutely. And it brings up such a good point. Joe and I have been working together for many years. We're very young. We won't tell you how many years. But one of the things that we see happening across the states is the not upholding of Tribal Public Health Authority. Again, why this conference, working with different agencies and also holding people accountable. There is also a government Office of Accountability report, which if you don't know what those are, is their Congress initiates them. They're nonpartisan, and they are used as kind of like the truth at a congressional level. You can also use them and kind of help push states. But one of the things that has been the most powerful has been to pass legislation in your state legislatures. There are some that are unfriendly to Native people. Let's just be honest. You're not going to pass anything there. But you can hold tight. And actually, somebody that Joe works with, Wayne, he gave me this example. You know, data sovereignty, indigenous data sovereignty isn't it its own thing. It's tribal sovereignty. It's the shield, and data falls underneath that. And so you need to add it into the verbiage that tribal leaders are using, that data belongs there. And we need to recognize when misguided attempts happen. So recently there was an announcement about a month and a half ago that as a result of a recommendation of the Not Invisible Act Commission, I recognize it as a good intention, recommendation under CMS data, so Centers for Medicaid and Medicare, there is now a code that you can use, a diagnoses code for MMIP. Now, if you look at how that was rolled out, it wasn't rolled out, right? Like it's just, well, this is now here. This is the reason it came from this recommendation. That code right now, from my personal perspective, is dangerous as hell. Because we don't know exactly what Joe was saying. We don't know why you're going to gather it. We don't know how you're going to use it. And we don't know how that may stigmatize or harm the relatives who are accessing care. And now it's in the coding for CMS nationally. So here's an opportunity in your individual states. It's the opportunity for tribal leadership. It's an opportunity for grassroots organizers to begin to push for and say, you cannot roll this out. Under Indigenous data sovereignty, you cannot roll this out until you have done meaningful tribal consultation, urban confer, and you have created a specific tribally approved plan for the usage of this code. As somebody who works in the healthcare system, I see the relatives we served being harmed by the data in their medical records all of the time. And this one in particular has the opportunity to be very dangerous. And the intention of the Not Invisible Act Commission was absolutely on the right track. But then as a result of changes in the administration, there wasn't the opportunities to do the work that you would normally do for something like this to roll it out. So now it's our responsibility. And we all need to come together to work towards that. Otherwise, some of the things that Joe talked about will happen, but we have the opportunity, again, for what that healing looks like. And I often think about this, my dad told us a story about when the Pawnees were removed from Nebraska, is that we had a bunch of white farmers who, that when we left, there was like a dance that happened. They cried with us. We were friends with them. And too often we look at governments, and I'm not saying they're not adversarial a lot, but there is also really good people in them, good opportunities. And we can't we can't forget. We have to remember that there are people who stand with us. And it is when we engage in them, and I think, again, Representative Simpson, that man cried with me in a congressional hearing. A Republican from Idaho. And I feel his dedication to ensuring the safety of Indigenous people. I feel his dedication to the upholding of funding for the Indian Health Service. And we need to work with these folks and be in relationship with them so that we can all heal together.